Once again, we thank our audience for joining us here today for our monthly speaker series. We are thrilled to have our local FASD workers from the counties of Lanark and Leeds-Grenville. Mariah has been working with Kids Inclusive as our worker here for, I'm going to say, almost a year now. And Shannon has just recently joined us, and we're just thrilled to have you as well. Thank you very much for joining us here, Shannon. So our presentation for today is the ladies are going to just really be looking at funding sources. This is something that gets brought up a lot within our organization, within our caregivers, is once you get that diagnosis or once you start to get connected with the organizations, how do you pay for these things? And so that's really what these ladies are going to be showing us today, are options that you should be exploring. Please know if you have any questions, you can always contact us at rulefasd@gmail.com, and we would always be happy to connect you with the ladies as well. So Shannon or Mariah, please go ahead.
Thanks so much, Rob. So Mariah and I, first off, would really like to thank you for giving us the opportunity to participate, learn, and grow with each of you. Mariah and I quickly realized that there is nothing simple about navigating through the various funding sources to ensure you receive vital supports for your children. So we're happy to take part in that and hopefully alleviate some of that stress of looking into the different funding sources. If we have missed anything, please don't hesitate to let us know so we can update our resources, because although we're navigating through this, there is so much information. So we'll do our best to see you through this.
Okay, so we'll start off by talking about the disability tax credit. So the DTC is a non-refundable tax credit that essentially helps individuals with disabilities and their caregivers reduce the amount of income tax they have to pay every year. This also includes a supplement for individuals under the age of 18 at the end of the year. And this also contributes to other federal, provincial, and territorial programs such as the Registered Disability Savings Plan, Canada Workers Benefit, and the Child Disability Benefit. So some of the eligibility requirements are, first, you must complete the Disability Tax Credit Certificate, and that must be approved. Then you need documentation from a medical practitioner indicating that a severe and prolonged impairment exists, and then just like a brief description of its effects. Then one of the following criteria must be met, which is being blind, markedly restricted in at least one of the basic activities of living, or be significantly restricted to 2 or more basic living activities, or need life-sustaining therapy. In addition, the person's impairments must meet all of the following criteria. So it must be prolonged, either it has lasted or it's expected to last a continuous period of 12 months, be present all or substantially all of the time, at least 90%. And the cumulative effects of these significant restrictions are equal to being markedly restricted in one basic area of living. So the maximum amount is $8,576, and the maximum supplement for persons under the age of 18 is $5,003. So I know this is a lot of information. So I'll just let you know that at the end of the presentation, we've included some helpful links and resources, which we'll review at the end. But for more information, you can refer to those. And as well, Rob, we can provide you with a copy of the presentation so it can be shared as well. Okay. So next we'll talk about the Special Services at Home, also referred to as the SSAH. So this is intended to help children with physical and or developmental disabilities essentially participate and engage with activities and events in their communities. So families can receive up to a maximum of $10,000 per year. The eligibility criteria include, you must be an Ontario citizen, require more than most families can support, You must be living at home with family, or if you're not living at home, you can't be receiving any residential services. So the application process, you can obtain the application by visiting the Ministry of Children and Youth Services website, or you can ask your FASD worker, because we also have the applications as well. And for this application, you also need a medical statement or psychological assessment, essentially the same as the DTC, describing the disability, explanation of needs, and then the estimated cost of sort of needs and services to help. Then you just mail the application and require documentation to your regional office. And with the SSAH, it does require a yearly reapplication. So some of the eligible supports, mainstream specialized camps and programs, advertising for recruitment of a special services or respite worker, travel costs associated with transporting special needs children or the worker, basic supplies to implement different programs at home. So this can be like flashcards, like the little Velcro pictograms, things like that. Membership fees for special needs associations, and as well, homemaking services. So this will pay for a worker to come in and sort of complete housekeeping, lawn maintenance to allow for you to spend more time with your children. So again, there will be a lot more information at the end of the presentation as well.
The next one is the ACSD, which is Assistance for Children with Severe Disabilities. This funding source provides a monthly benefit to eligible families to help offset the costs associated with the care of a child who has a severe disability. So this funding source will provide a monthly benefit of anywhere from $25 to $500, let's just round it up, depending on your income. So it is income dependent. Low and moderate to income families qualify. And then there's a threshold based on how many people live in your household. So the size of your family, the severity of the disability, and the extraordinary costs related to the child's disability. This funding is available for those who are under 18, live at home, and live with a severe disability. And it, again, requires documentation confirming a medical diagnosis. If you're approved, you'll receive a letter confirmation accompanied by how much you will receive. If you're rejected, you'll receive a letter saying that you don't qualify, but it will also outline the appeal process. And you should receive the stipulated monthly funds if you're approved automatically until the child turns 18 without having to reapply. So different than the SSAH in that facet. Some of the things that can be used, the funding can be used for are travel to doctor's appointments, hospital appointments, adaptive shoes or clothing, parental relief such as respite, providing you trained caregivers, social opportunities, wheelchairs and other assistive devices, including the repairs, hearing aids and batteries, prescription drugs, babysitting and childcare, or summer camps. And again, when you go online, it always says to contact your local regional office. And we learned very quickly that that's difficult to do, especially with the pandemic. So Mariah and I do have copies of these applications. So you can just ask us for one if you are struggling to find it like we did. And then the next one is the Assistive Devices Program. So this is a provincial program that helps individuals with physical disabilities by providing financial assistance for many kinds of equipment and supplies. So income is not a consideration with this funding source. The ADP, or Assistive Devices Program, covers 75% of an index price. So there are companies that are approved by this program, and 75% of the price that they set will be paid, and then you are responsible for the remaining 25% at the time of purchase. ADP will cover 100% of the cost of these items if you are receiving financial support from Ontario Works, Ontario Disability Support Program, or the previous slide, Assistance for Children with Severe Disabilities. To qualify, you need to be an Ontario resident, have a valid Ontario health card, and have a disability requiring the equipment or supplies for 6 months or longer. Some of the eligible items are wheelchairs, walkers and strollers, hearing aids, visual aids, artificial limbs, prosthetics, personal FM systems, communication display boards, and writing aids. So I think the last two apply a lot, like, to most of our families. So writing aids, meaning portable or stationary computers to be used with assistive technology. And it also covers the software or hardware that goes along with that. For example, text-to-speech software, voice dictation software, or mouse alternatives. This is kind of a tricky one in terms of finding exactly how to apply, or at least that's what I found when I was researching it. So each application is based on a category of an assistive device and requires its own application. So a communication device versus a visual device, they're different applications, and the process that goes along with it requires verification along the way. So a speech and language pathologist or an occupational therapist may prescribe or suggest an item, and they have a portion of that on the form to fill out, and then the vendor will also have some information that they need to add to that, as well as yourselves. They aim to review your application within 8 weeks, and then we've just included a link at the bottom of ADP certified vendors. A note, you don't have to use an ADP certified vendor, but there is a whole other process if you're not going to use one of the ones that are already approved. Jordan's principle ensures all First Nations children living in Canada can access the products, services, and supports that they need. It is in memory of Jordan River Anderson. He was a young boy from Norway House Cree Nation in Manitoba. The eligibility for this funding is that a child under the age of majority in their province or territory of residence can access Jordan's principle if they are permanently residing in Canada and if the child meets one of the following criteria. So just one of these, not all of them, is either registered or eligible for registration under the Indian Act, has one parent or guardian who is registered or eligible to be registered under the Indian Act, recognized by their nation for the purposes of Jordan's principle, and or ordinarily a resident on a reserve. Funding can help with health, social, and educational needs, including the unique needs that First Nations, Two-Spirit, and LGBTQIA children and youth, and those with disabilities might have. So basically, reimbursements through this funding source basically cover most of the reimbursement possibilities of some of the other funding, but I think one of the ones to kind of point out is that they do assist with assessments, which can be very costly for families, and specialized programs based on the cultural beliefs and practices of the child in need. So requests for specifically Inuit children can be made through the Inuit Child First Initiative, which is separate, and then they have a great 24-hour, 7 days a week phone number where they can be reached, and we've included the web address there as well. Easter Seals is a fantastic charitable organization that offers a variety of services to help children with physical disabilities and their families. They offer funding assistance for essential mobility and accessibility equipment. So one of the main funding options is there is an equipment funding program. So this program assists with funding for mobility equipment, communication devices, and partners with ADP, which we talked about in the previous slide. It also assists with orthotics, accessibility equipment, bathing and toileting equipment, and we've included the link for the items that are options there. In order to qualify for that equipment funding program, they need to be under 19, registered with Easter Seals Ontario, a legal resident of Ontario with a valid Ontario health card, and have a permanent physical disability that restricts their independent mobility and results in the use of a primary mobility device. The Access To program is pretty neat. So it's just a program that pays for the entry of a support person to a community event or activity. So one of the local examples would be our Aquatarium. So The child would pay for it. So say they went out with a respite worker, the child would pay their entry into Offertorium, but the support person wouldn't be responsible for paying for their entry. So that's nice. And I think one of the more popular ones through Easter Seals is the Incontinence Supplies Grant. So this is for youth who have a chronic disability that results in irreversible incontinence or retention issues that last 6 months or longer, and it provides $200 to $900. And I think what's important to know with this one is it's from the age of 3 to 18. And then they also offer a variety of other great programs, post-secondary scholarships, advocacy, the Northern Health Travel Grant, and an ambassador program, and then of course the Easter Seals camps. And we've included the link to check out the different camp options.
Okay, so now we'll move on to respite. So I'm sure, as many of you know, this is a very, very complex service. It's very difficult to navigate, and oh my goodness. So there are a lot of options. However, it can be very difficult to try and track them down and access them. And then with everything that the pandemic has put on us, it has further limited the respite options available. So out-of-home respite is offered to families of children with multiple special needs, and they can receive up to 7 days of out-of-home respite per year. So this can be provided in a location other than their home. So this is allocated by the Brockville and District Association for Community Involvement, BDACI. And essentially it's based on the number of applicants that apply for this resource, and families can receive up to $3,500 per year. So the eligibility criteria, they must be 18 years of age or under, have multiple special needs because of a physical and or developmental disability. They must live at home and need care 24 hours a day, 365 days a year. And without out-of-home respite, there's a real possibility that the child would require long-term residential placement. The child's family would be at risk of a breakdown, or there's a risk that the child could harm themselves or others. And I just think an important point to note that specific to FASD, one of these criteria that are especially relevant would be supervision, and just the fact that a lot of times these children, they do need to be sort of monitored 24/7. So they would definitely apply for that aspect as well. So to apply, of course, contact the ministry's regional office nearest to you, or ask us and we can help. So with, as I mentioned before, the restrictions of the pandemic sort of hindering access to respite even more, the Ministry of Children, Community and Social Services is offering a $3 per hour wage increase for direct support workers providing direct assistance with personal care, respite care, and community activity participation. So this has been extended to June 30th. So the eligible programs for this wage increase are the Ontario Autism Program, Childhood Budget or Interim One-Time Funding, Enhanced Respite for Medically Fragile and or Technologically Dependent Children, the SSAH, and the ACSD. So they've added some new eligible items for expenses, just with the limits of the pandemic and the restrictions. So they've added some sensory items, some technology, so things like laptops, iPads, computers that were not included previously. They are accepting those as eligible items now. Items that support home-based recreation activities, so things like gym equipment, trampolines, which is really, really awesome as well, because I know a lot of kids sort of rely on using the gym or other sort of recreational activities. personal protective equipment, so things like masks, hand sanitizer, gloves, that kind of stuff. Essential service delivery fees, so that can be like having your groceries and medications delivered to your house. Behavioral support plans and related interventions, and the ability to hire non-primary giver. So essentially, with the pandemic and the restrictions, the already limited respite worker options, the pandemic has just sort of worsened that. So they're allowing friends, family members, neighbors, they're allowing you to use these individuals to provide respite and sort of give them respite allowance. So then another sort of interesting and we thought it was good to include is Healthy Smiles Ontario. So this is a government-funded dental program that provides free, preventative, routine, and emergency dental services for kids under 17 from low-income households. So this service provides checkups, cleanings, fillings, x-rays, scaling, tooth extraction, and sort of any emergency dental care. The eligibility requirements, you just have to be 17 years or under, an Ontario resident, and you must come from a household with equal income or less than, and there's a very complicated chart with a whole bunch of income breakdowns. We've included the link there. You can go and check it out, and then it just breaks it down by number of dependents in your household and average annual income. So children are automatically enrolled in the program if they receive assistance under temporary care assistance and the ACSD, or if they or their family receive Ontario Works or Ontario Disability Supports. So then we added some information about ODSP. We didn't go too much in depth with the ODSP just because the website provides so much information. It's very thorough, and there's a breadth of information on there as well. But for the ODSP, you must be at least 18 years or older, be an Ontario resident, and be in financial need and essentially meet the program's definition of a person with a disability or be a member of a prescribed class. So again, we've included the website information that sort of breaks down what's considered to be part of a prescribed class. So for your application for ODSP, you have to have your personal information, info about any other members in your household costs, and any other shelter or resident related costs, and your household income and any assets. So when you are accepted for ODSP, you will be assigned to a caseworker that will help you sort of work through your funds and your what you're eligible for, and then you will receive a monthly allowance. You can apply by phone, typically in person, but I don't know whether that's happening right now. And you can also apply online. And again, we just included the website information there.
Passport funding. So again, all of this kind of goes on with that transition of reaching 16 and what's going to happen going into adulthood. So the passport funding is funded by the Ministry of Children, Community and Social Services. It helps adults with a developmental disability be involved in their communities and live as independently as possible. Basically, in order to be eligible, you have to have a developmental disability, live in Ontario, and be 18 years or older. However, the caveat is to reduce the service gap between children and adult services, you should start the application process early and start applying at 16. So when your children turn 16, start gathering the documents and start this process. So with all of the correct documents, you can be confirmed eligible for adult developmental services at age 16. So you won't start getting funding. However, once your child turns 18, they will get that funding. So this is administered through the DSO, so Developmental Services Ontario. They facilitate and assist in determining your eligibility for this funding and finding the types of services and supports you need, as well as the related services in your community. Passport funding is allocated to anyone who is eligible for developmental services. ADSS and SIS applications will determine further funding amounts. So basically, funding starts at $5,000. That's the minimum amount. However, if you go through the extra applications, the ADSS and the SIS, it will further determine eligibility for funding. So that could go up to $40,250. So depending on what they find in that assessment in terms of the needs and supervision required. And this is an annualized funding. So we included the link to DSOontario.ca, the transition planning. And I do want to say that Mariah and I attended a training through DSO, and it was fabulous, and their website is super easy to navigate. So I highly recommend all of the families with kids coming up to 16 to get on there and start familiarizing yourself with the website. And I also have contact information for people, professionals who work for DSO, who would be willing to help navigate if you find it too difficult.
Yeah, they were very, very open and willing to help service providers and families with that process, which was awesome.
Yes.
Sorry. As we mentioned before, we just added some additional resources and helpful information for you guys. So the first few are YouTube videos. So the first one is kind of like a DTC 101. It's really helpful. It has a lot of really, really good information in it, and it kind of just like breaks it down a little bit better than I did earlier, I'm sure. And then there's a link to free tax clinics and related information with the Government of Canada website. And then these 2 how-to guides, these were so helpful. Basically, I believe it was Surrey Place that posted them, and they kind of just break down the process of completing the application process for the ACSD and the SSAH. Really helpful. Definitely recommend looking into those, and they answer sort of frequently asked questions and areas that families and people struggle with when completing the application process. And then there's step-by-step instructions for filling out the T2201 form. So that's the initial step for applying for the DTC. And then we just provided some general information about tax credits and deductions for persons with disabilities. It's just some supplemental information to what we've described. So like Shannon said in the beginning, we are by no means experts or professionals, and we are kind of learning along with you guys as well. So if we missed anything, or if you guys have anything you think we should know about, please let us know. And also just know that we are here to help you guys navigate through the different funding options, and we understand and definitely experience the frustrations and struggles with accessing funding.
And if we don't know, we'll find out.
Yes. But thank you so much for having us.
Thank you.
So once again, thank you, Shannon and Mariah, for joining us here today. This was certainly really helpful information. I certainly learned a couple things new. I had no idea about the assistive technology one. So that was, that's definitely one we're going to talk about off camera here in terms of how we go about in handling that process. Certainly, we also know that the process itself is the applications, they're difficult. And that's why, again, we're just thrilled to have both of you join us. To all of our audience out there, if you're going to look at doing these applications, please talk to your FASD worker. Make sure that you're talking with someone else that's in that field. I know from my own personal standpoint, trying to figure it out on your own is really, really difficult, especially when you're not in that particular field. So seeking that help is a huge part. The other couple that I would mention as well that doesn't really fall under funding, but we happen to know if you're a family that has a occupation as a caregiver that you have a benefit package of some type, all of my adult children are actually going to remain on my benefit package for their lifetime. So that is one that is to keep in mind. I don't know if that's the case with all benefit packages, but I do know with Manulife for sure. Because of their diagnosis, they were accepted from a lifetime standpoint for all of my benefits. The other one to be aware of as well is Air Canada will allow any child with FASD to fly for free. So if, again, there's an application process to complete with that, but basically if you can, it's that doctor's note again, and if you can demonstrate that they are not able to navigate through an airport and on a plane by themselves, and so they have to have they have to have a support worker with them. They will allow them to fly for free. And the other airlines do similar things, discounted prices and so on. So that's always one to be mindful of as well. So once again, we thank our audience for joining us here today. As I said before, if you have any questions and want to follow up with this, we do have a lot of templates within the Rural FASD Support Network in terms of what we've discovered. Language around these applications is extremely important, and so make sure that you talk with your FASD worker. If you're not sure who that individual is, always feel free to contact us at ruralfasd@gmail.com, and we would be more than happy to get you in touch with the proper person. Once again, thank you very much, and we'll see you next month.